Hi, my name is Sharon Tran. I'm a veteran with the U.S. Army. I worked at the emergency department at the VA in Long Beach.
My name is John Wells. I work in nutrition and food service in different areas in the facility, and I was in the Army.
My name is Yvonne Jimenez Gonzalez. I am the Chief for Quality Safety Value Service at VA Long Beach. I'm also a 13-year Army veteran.
Hello, I'm Howard Leak. I'm 70 years old. I'm a United States veteran. I work at the VA Hospital Long Beach.
So my name is Bindu Swaroop. I work at the VA Long Beach. I am Chief of the Medicine Healthcare Group here.
My name is Dr. Mark Cook. I'm a psychologist as well as a veteran from the Marine Corps, and I work in the spinal cord injury unit.
I'm Mark Levenstein. I'm the Chief of Geriatrics and Extended Care. I work in our community living center, blind rehab, and our outpatient geriatric clinics with the frail elderly.
And I decided to get the vaccine because I want to keep myself protected, my family, and the veterans that I work with.
Now, what motivated me was so many people dying. And it's not just the people dying, but all of those people that are close to that individual, all the heartache and the hardship that they have to go through.
My grandfather is a Navy veteran. He is 94 years old, and the last time I saw him was probably the end month of March when we first learned about the COVID virus. And since then, I've not had an opportunity to see him in person.
I'm taking the vaccine for the coronavirus because I think it's in my best interest for me and my family. We're up in age. I'm 70 years old, and Mom's is older than me, and I don't want to get her sick and something happens because of me.
For me, the biggest motivation is twofold. One is to be able to know that I can safely visit my friends and my family, start seeing my parents again, who I've been distancing from for fear of giving it to them as a healthcare worker.
I've had COVID. I know what it's like to have been out for 2 months, to have been in the hospital for 5 days and feel really miserable. I don't want to feel that way ever again. I don't want anyone else to feel that way again. That's why I'm getting vaccinated.
I decided to get the vaccine after some reservations, being that the vaccine is still new in the market. But I've read up on this with the CDC and some of the reports, and I feel comfortable with the 95% efficacy.
Forget about superstitions, forget about critics and all that. Do what is most healthy for you and for your loved ones and for the people that you're going to be around in a working environment and whatever limited social environment you're going to be in.
When something is brand new, especially in the scientific field, there's always a little hesitation and concern. But I'm really fortunate that I have access to all the major articles. I've been involved in the discussions and conversations and been able to talk with leading experts in the COVID-19 vaccine development.
There's a lot of information out there regarding the side effects of this vaccine. Only you can decide what's going to work for you.
Even though I have apprehension about it, it makes me anxious because I have a lot of health problems.
I don't trust politics and politicians, but I trust the doctors and the scientists, so that's why I'm going to take my chances.
I was nervous at first, but I think in the end, because of my where I work is a high risk factor, and so I wanted to make sure I get protected.
We have to stay positive, and I think the future is good. I think it is going to be bright, if it's not bright already. I really do feel that way. I know we have a long ways to go, but I'm very, very happy that I got the vaccination.
The only way we're going to be able to get past this is if we all get out there and do our part.
I can completely understand that many of our patients, many of our veterans may have concerns or anxieties or be nervous about receiving a vaccine that's new.
Getting the shot was a big relief, and then of course I came down a little bit because I realized that I didn't have full immunity, but I still carry that. They carry that with me. Exciting because there's more options and opportunities on the horizon.
I feel relieved that that I just got my vaccine. I'm hoping that this will be the answer to our problems, and that I'm looking forward to life going back to normal again.
I feel fortunate. I feel relieved. I'm very happy. Happy it was when we were in the room getting our shots. It was incredibly optimistic and very positive feeling, and a very much a togetherness.
You know, it has really been a profound experience because certainly before having the vaccine, I was so worried about being around my grandfather who is a veteran. And now it's going to give me some hope.
Even though I take my shots, I'm going to still wear my mask and stuff like that and distance myself away from people until everything is back to normal. Besides, if it don't never get back to normal, I guess this is my normal.
Now that I received the first dose of the vaccine, I feel excited and I feel hopeful. I finally see a light at the end of this dark tunnel we've been experiencing over the last 9 months.
I thought it was important to have it. I still think it's important to have it. And even though I had some side effects, I'd do it again. And I'm certainly going to get the second vaccine.